Do you get knee pain when climbing stairs? Hi, I'm Dr. Dave Candy, and in this video, I'm going to explain what can cause knee pain when climbing stairs and two really easy, simple tips that you can use to be able to go upstairs without having knee pain. Now, if you find this video helpful, give it a like and subscribe to our channel. We help people to stay active, mobile, and healthy without relying on pain medications, injections, or surgeries. So first of all, what are the things that can cause knee pain when climbing stairs? There are a lot of different things that can cause knee pain, but generally there are three different types. There are pain inside the joint, like arthritis, for example, and that's a pain between the lower leg bone, the tibia, and the upper leg bone, the femur. You can also have meniscus problems that also cause pain inside the joint. You can have pain in the patellofemoral joint, which is the pain between your patella, your kneecap, and your femur, your thigh bone. And then the third type is soft tissue pain that comes either on the inside or outside of the joint. So what do you do for pain that comes from inside the joint? Well, if you have knee arthritis or you have a meniscus tear, a lot of times compression does increase the pain in the joint, and you do get increased compression when you're on one leg going up and down stairs. But even a bigger cause than the compression is rotation between the upper leg bone, the femur, and the lower leg bone, the tibia. So if you get a lot of this type of movement as you're climbing stairs, then you can get some twisting between the two joint surfaces, and that can grind the joint surfaces together. And if you've already had a wearing down of the cartilages in the joint, for example, with arthritis, then that increases the pain that you'll have in your knee when you're climbing stairs. So how do you prevent that rotation between the two joint surfaces? Well, a lot of that is controlled by your hip. That if your hip is weak, it causes your knee to go inwards. And because your foot's planted on the stair, it creates a relative twist and side bending of your joint. And what that does when your knee goes inwards, it compresses this outside compartment of your knee joint. And it also creates some rotation or twisting between the two joints where it grinds the joint surfaces together and can irritate the knee cartilage or the subchondral bone underneath the knee cartilage or the meniscus if you have a meniscus tear. So a really easy way to prevent knee pain when you're climbing stairs is to prevent that twisting. And one big way you can do that is just turning your knee out slightly. It's going to feel like you're turning it way out that way if your norm is allowing it to go in. But focus on turning it out so that it's in a neutral alignment, in a line with your toes. So you want to put your toes on the stair, get your knee right over top of it, and then turn out a little bit more than you feel like you should probably have to. And then push up the stair so that your knee doesn't drift inwards like that as you're climbing stairs. So that's the first tip for preventing knee pain when you're going upstairs. Now that also helps with the type of knee pain in the soft tissues on the inside and the outside of the knee. That you have some tendons that run along the inside of the knee called your pes anserine. That comes from your inner hip, inner thigh muscles called your adductors, as well as one of your hamstring muscles that wraps around and attaches to the front side of your knee. And so if you're twisting inwards, it puts a stress on all those tendons where they wrap around the inner side of the knee. Additionally, your IT band that comes from the hip also crosses around the outside of the knee and into the front of the knee. And it can create some abnormal stress or twisting on that IT band if you're twisting inwards like that. So again, that same tip of turning the knee outwards slightly and pushing up can help that knee pain on the inside or the outside of the knee if it's coming from soft tissues. Now, the second tip has more to do with the patellofemoral type of pain, where you get compression between the joint of the kneecap and the thigh underneath and the femur. There's a little joint where normally that kneecap should slide up and down in a groove on the thigh bone. But if your quad muscles are too tight or you're using too much quadricep force to climb the stairs, then you create more joint compression between the patella or the kneecap and the femur, which is underneath. So in order to prevent that, you want to use your quadricep muscles less. Now, how do you do that? Because you still need the same amount of force to climb up the stairs. So to climb up the stairs, you use a combination of your quadriceps when you're going up, as well as your glute muscles, particularly your gluteus maximus muscle. So when you go up the stairs, if you try to stay perfectly upright, that uses a lot more quadricep. If you lean forward slightly when you're climbing up the stairs, then that engages your glutes more. And if you make it more a motion of leaning forwards, then pushing your hips underneath of you, like that as you're climbing up the stairs, rather than making it a knee extension movement where you're using your thigh muscles to extend your knee, you're using your glute muscles to push your hips forward. And that transfers more of the effort onto your glute muscles and less onto your thigh or your quadricep muscles. Now, there are some other tips that can help out with climbing stairs beyond these. If your quadriceps are too tight, then it can be helpful to stretch those. If your calves are too tight, it prevents you from getting the adequate movement in your ankle that you need to get your knee over your toes or to get the movement going this way. So stretching your calves can be something that's also helpful. Additionally, manual therapies to help get the joint in alignment if you have an internal joint problem or a soft tissue problem on the inside or the outside of your knee and you're getting a lot of rotation in the joint. Doing some manual joint mobilizations with a physical therapist can be something helpful to realign the joint and get it moving properly. Sometimes that makes a pretty quick difference in the pain levels. Additionally, if you've got quad muscles that are too tight and are causing compression on the kneecap, physical therapists can do some hands-on treatment to the thigh muscles in order to get the thigh muscles to relax a little bit. And so that decreases the amount of compression force between the kneecap and the thigh bone underneath of it. So if you happen to be in St. Louis and you're having trouble with your knees or you're having pain climbing stairs and you'd like some help to get it to feel better a little bit faster, then we'd be happy to help you out. Just contact us at More for Life and we'll get you scheduled for an appointment. And no matter where you're watching this video from, if you found the tips in this video helpful, give the video a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching and have a great day.